let us begin with an easy but all-time favorite question, giving you 30 seconds for the same. And here you go. Will you take micro important topic revision? Abhi I told you, Dr. Sachin, abhi bataya. I posted 20 hours of micro crash course. What else? 20 hours of micro crash course I have posted on the Telegram group. Nothing more you need beyond that. So pick up the links from the Telegram group, and beyond 20 hours, not needed at all. It's time bhi nahi. Okay, 70% of you've got this right. Good. So I don't think you read most of it. You probably picked up, if you know the image well, you've picked it up pretty well. So first and foremost, you've got a young athlete. I think here itself half the answer was given, and here half the answer was given. So you've got a young 19-year-old basketball player who collapses on the court. Classical history of death in a young athlete. Classical history of death in a young athlete. Very, very classical. Okay, the cardiac monitor shows ventricular tachycardia and then ventricular fibrillation. He was hospitalized. Obviously, parents' history, patient ki history dekhe. So this indicates his father died suddenly at 38 years of age. There's a left ventricular wall that is thickened and a small slit-like chamber. What are they trying to tell you over here? Small slit-like chamber, which particularly they are trying to say. They also say the interventricular septum is markedly thickened. So if we try to draw it out, they are saying that the interventricular septum is markedly thickened and the lumen has become very, very narrow. Yes, banana shaped heart. Okay, 5 years later, the patient expires suddenly. Histological examination of the heart muscle at autopsy is shown in the picture. Picture में क्या दिख रहा है? Muscle है, cardiac autopsy हुआ है, heart muscle autopsy. One fiber is going here, one is going here, one is going here. सारे fibers different directions में जा रहे हैं. Agreed? Everything has come in track for hypertrophic cardiomyopathy. Please remember, when I talk about hypertrophic cardiomyopathy, what is getting hypertrophied? Which part of the heart is getting hypertrophied? Interventricular septum. अभी जो हमने highlight किया था, interventricular septum is getting thickened. When the interventricular septum gets thickened, can you see the left ventricular chamber looks like a narrow slit? Can everyone appreciate this banana shaped heart? That was written in your question. Who will tell me the etiology? Why does this get thickened? What is the defect? What is the defect? I think someone had already written. Very good. Titan not over here. Here it is beta myosin heavy chain. Beta myosin heavy chain defect is noted, not titan. When I say titan mutation कहाँ होता है guys? Titan mutation is in dilated cardiomyopathy. Dilated cardiomyopathy. Beta myosin heavy chain defect is seen in hypertrophic cardiomyopathy. I see a banana shaped heart. And thereafter, when I do the microscopy of hypertrophic cardiomyopathy, I see helter-skelter. Can you see all muscle fibers going in different directions? Helter-skelter appearance of the muscle fibers. Total haphazard, disarray. उसे एक fancy term दिया है. Yes, the disarray has been given a fancy term, that is helter-skelter appearance. Classical 3 points will help you. Number 1, death in a young athlete. Number 2, banana-shaped heart. And number 3, cardiac fibers being disarrayed. That's all you need to know in this particular question. Okay, having said that, related to the same lineage of questions, let's pick up one more over here. Read very carefully and then answer. I'll give you 30 seconds again. This is your type of question. Whenever I say your type of question, it means retrospective solve होगा वो. Okay, 65, 59%. Last 3 seconds, guys. Attempt. Attempting is important. Wrong, right is really not important over here. These are practice sessions. Okay, let me read retrospective. How could I have solved this question within, say, 10 seconds? Endomyocardial biopsy discloses interstitial pink amorphous deposits between the cardiac myocytes. Matlab, for example, if this is a cardiac muscle fiber and if this is a cardiac muscle fiber, the deposit, first and foremost, they are saying pink. तो pink color का deposit fibers के अंदर है. Is it intracellular? No, they are saying it's between the fibers. It's between the fibers. So what is your deposit? Is it intracellular or extracellular? Obviously it is extracellular. The first hint that was given in the question. Okay, the second hint they say it is pink. Okay, everything in pathology is pink, so what's the big deal about it? It is amorphous. When I say amorphous, matlab A means no, absent. Morphous means morphology. कोई morphology नहीं है. मतलब do they have any nucleus? Do they have any organelles? Nothing. They have no morphology. Why? Because they are nothing but proteins. They are nothing but proteins. So please remember, now put everything together. Extracellular protein in the heart. What all can I have from this? Have they mentioned anything about hypertrophy? No. Dilated cardiomyopathy? No. Rheumatic heart disease में क्या mentioned होता? Rheumatic heart disease में what should have been mentioned? Very characteristic ash of bodies, है ना? Everyone knows ash of bodies should have been there. Nothing of that sort is mentioned. Then we have amyloidosis left and carcinoid heart disease left. Okay. कार्सिनॉइड हार्ट डिजीज में कोई वैल्व होगा जो हमेशा मेंशन्ड होगा. इट इज नॉट गोइंग टू हैव दिस काइंड ऑफ पिंक अमॉर्फस मटेरियल. कार्सिनॉइड हार्ट डिजीज क्लासिकल. Tricuspid regurgitation is the most common cardiac manifestation of carcinoid heart disease. Most common. Acha, before I begin, before I proceed, someone said something about the audio. Is there a problem with the volume? Any issue anyone else is facing? No, then please refresh just in case you're facing any issues, right? Okay, so nothing about that. Now let's read the question. Clear cut answer to I've got. It is cardiac amyloidosis and it's very obvious because amyloid का definition क्या होता है? Amyloid is an extracellular protein. Extracellular is always the catch point. Amyloid कभी भी cells के अंदर नहीं होगा. It is always extracellular. Okay, so you had a 60-year-old man, senile. Okay, presenting with increasing girth and fatigue. Girth is increasing. Why? Because physical examination reveals edema, ascites, and hepatomegaly. Liver function tests are normal. Echocardiogram shows a remarkably enlarged right heart, but no signs of valvular heart disease. No signs of valvular heart disease. So, valvular heart diseases wali cheezein ruled out hai. So, what is it? Classical case of amyloid. And now tell me, obviously, I am clearly talking about systemic senile amyloidosis. Systemic senile matlab old age. Yes, my patient is old age patient hai, 60-year-old. Systemic senile amyloidosis mein you will say that, ma'am, I've understood amyloid. I've understood senile 60 years. Systemic में तो बहुत सारे systems होने चाहिए, बिल्कुल हो सकते हैं. You never know that the hepatomegaly has some relation. As of now, I know that there is a remarkably enlarged right heart because the most common organ affected in systemic senile amyloidosis is the heart. Is the heart. Other organs are affected or not? Could be, but heart सबसे common है. And this type of amyloid, which all of you are saying, is definitely ATTR. सबसे common जो systemic senile amyloidosis होता है. A for amyloid, obviously. TTR, what's the full form? TTR, transthyretin. Excellent. Transthyretin. Amazing. So this was just extra information that you needed. Otherwise, the question was pretty much obvious. Two questions now I want on this, which I'm going to ask you. एक तो सबसे easy वाला, confirm करना है तो stain का नाम बताओ. If I want to confirm amyloid, the best stain which I will be using, easy. This is giveaway question. क्या है? Congo red. Okay, very good. So Congo red से again related, I want to ask you three questions. If I see this Congo red on a light microscopy, what will I see? What color will I see? Okay, I'm going to see a salmon pink color. Very good. If I see the same amyloid with Congo red, under which microscopy will I see that apple green birefringence? Under which microscopy? Yes, excellent. Under, not electron, guys, under polarizing microscopy. Under polarizing microscopy, I will be seeing the apple green birefringence. Okay, this was easy question. दूसरा question क्या है? Amyloid, what problem or which cardiomyopathy can it cause? Heart में कौन सा cardiomyopathy होता है? Amyloidosis causes which cardiomyopathy? Very good. It causes restrictive cardiomyopathy. No, not dilated. It causes restrictive. Most of you are right. Restrictive cardiomyopathy, definitely yes. So this was an easy question. Two questions to do with the heart. थोड़ा सा और आगे, maybe not heart, something apart from heart, related to heart. One more question. 50-year-old woman with type 2 diabetes and hypertension undergoes a renal biopsy. The renal biopsy image is given here. I am giving you 15 seconds to answer this. Remember, renal biopsy, diabetic hypertension. क्या दिख रहा है? I think everyone has given me the favorite answer that you always give. Just because it is saying diabetes and hypertension, तो सबने अपना favorite answer दे दिया है. Okay, the answer to this question, first and foremost, how many of you just read diabetes and have blindly, 44% of you have read diabetes and बिल्कुल diabetes सुनते ही you marked KW lesion, है ना? So first and foremost, I agree that your patient is diabetic, but your patient is also hypertensive. And any renal biopsy in a diabetic patient does not always mean KW lesion. सबसे पहले तो get over this fact. Every time you have to see the picture also, ना? तो picture देखते हैं. First and foremost, tell me first, I'll clear your confusion. KW lesion is seen where? Is it seen in a blood vessel? Is it seen in a glomerulus? Where? Which part of kidney do you see it in? Yes, we see it in a glomerulus, guys. We see it in a glomerulus. First, see your KW lesion. सबसे पहले तो this has both the things which I want to show you. Can you see that this is an entire glomerulus? Yes. Was anything like this seen over here? Was this the glomerulus? Not at all. अगर इसमें zoom in की थोड़ा सा देखा होता, red color दिख रहा है guys. You can see some red color inside it. This was red blood cells. This is a blood vessel. This is a blood vessel. This was not the glomerulus. So this should never have been the Kimelstein-Wilson lesion. So first and foremost, this is Kimelstein-Wilson lesion. Can you all see this big glomerulus out here? So tell me, what is Kimelstein-Wilson lesion? Can anyone help me with the other name? Tell me the theory, and then I'll tell you the image for it. Perfect. If you know the theory well, you will always pick up the image. Kimelstein-Wilson lesion का दूसरा नाम है nodular. Are you seeing any nodules over here? No. Glomerulo. Are you seeing a glomerulus over here? No. Sclerosis. मतलब pink color material. तो यू से मैम पिंक कलर मटेरियल तो है, अग्रीड, बट ग्लोमेरुलस नहीं है, नोड्यूलर नहीं है. दैट इज व्हाई इट्स नॉट केडब्ल्यू लीजन. Now remember this, nodular glomerulosclerosis. Now agree. Do you see pink color material? So I'm saying nodular glomerulosclerosis. Pink color material दिख रहा है, तो sclerosis है. Is this the glomerulus? Glomerulus है. And can you see one nodule of pink material? One nodule of pink material, one nodule, one nodule, one nodule. Nodular दिख रहा है? Is this fitting into nodular glomerulosclerosis? This is KW lesion. So first and foremost, I agree KW lesion is the most characteristic lesion in diabetes. Most characteristic lesion in diabetes is KW, but every diabetic question is not KW lesion. अब आंसर क्या था इस क्वेश्चन का? Hyaline arteriolosclerosis. Listen to this. Sclerosis and hyaline. Does it mean pink color material? Yes, you'll say, ma'am, yes, I'm seeing pink color material. Arteriolo, you are supposed to see it in a blood vessel. Yes, this is a blood vessel. And I'll show you something very interesting. See, ये ग्लोमेरुलस के साथ एक छोटा सा ब्लड वेसल दिख रहा है. एवरीवन, कैन यू सी दिस टाइनी हाइलर ब्लड वेसल? दिस मस्ट बी द ग्लोमेरुलस एंड दिस मस्ट बी द ब्लड वेसल which is entering. So can you see this has all pink color material? This is the hyaline arteriolosclerosis. This is the hyaline arteriolosclerosis. I had focused on this part over here. Hyaline arteriolosclerosis कहाँ दिखता है? First, it is seen in diabetes. Second, which hypertension? Benign or malignant? Which hypertension? Very good. So again, let us compare. पहले theory पढ़ते हैं, then I'll show you photos. Either this is the patient you had a patient of hypertension and diabetes, that shows you hyaline arteriolosclerosis, मतलब pink material in the arteries. Malignant hypertension होता तो ऐसा onion skinning दिखता, that is hyperplastic arteriolosclerosis. Hyperplastic arteriolosclerosis. So see the pictures again. See, now tell me, what is this, hyaline or hyperplastic? Batao, what photo of the blood vessel is this? What should I label it? Very, very good. This is hyaline arteriolosclerosis. Tell me the diseases. Tell me the diseases for hyaline arteriolosclerosis. Type 2 or any diabetes, like your patient was diabetic. Benign hypertension, like your patient had hypertension. ठीक है. Whereas what is this? Now can you see? एक छोटा सा blood cell है, red blood cell, and round like an onion skin. Like an onion skin, you have the appearance. हाइपरप्लास्टिक हाइपरप्लेजिया हो रहा है, तभी अनियन स्किनिंग बन रहा है. हाइपरप्लास्टिक arteriolosclerosis. What disease? Malignant hypertension. Are we okay with this question? I hope the first three questions of cardiac and blood vessel, important ones, are clear. कोई confusion नहीं है. Okay, let me see the other options also. Third option क्या है? Monkeyberg medial sclerosis. What is Monkeyberg sclerosis? क्या होता है? In one word, tell me. What is Monkeyberg sclerosis? Calcium. You'll say, ma'am, it's supposed to have calcium. Calcium तो blue color का होता है. I don't have any calcium anywhere blue color, no. Polyarthritis nodosa. Which necrosis am I supposed to see in polyarthritis nodosa? Which necrosis? PAN. P-A-N. Which necrosis? Very good. First chapter question. Fibrinoid necrosis. Fibrinoid necrosis. Not seen. And nothing mentioned about PAN as such as well. So, this is my final answer. Acha, having done this, let's change and go to the all-time favorite question. Question number 4 ho gaya abhi. Easy, 15 seconds I'm giving you. This, if you don't get right, then you had it. This is the easiest question of pathology. The following thyroid tumor cannot be diagnosed on FNSE. If you've attempted previous year NEET, INICET, FMGE or any exam that you're preparing for, ये question attempt करा है. 58% of you have given a right answer. So first and foremost, अच्छा, one question, hyaline arteriolosclerosis is also fibrinoid necrosis? नहीं, they are totally different. Fibrinoid necrosis is necrosis. Necrosis is cell death. How can cell death and hyaline change be the same? वो तो cell death हो गया ना, तो बिल्कुल different. Okay, the following thyroid tumor. First and foremost, there are 4 thyroid tumors: papillary, follicular, medullary, anaplastic. Follicular thyroid cancer, ये favorite question है, cannot be diagnosed on FNAC. So basically, you will say, ma'am, what are we talking about over here? I am talking about follicular के 2 ट्यूमर्स हो सकते हैं. बिनाइन ट्यूमर का क्या नाम रखें? फॉलिक्यूलर एडिनोमा. फॉलिक्यूलर एडिनोमा. मैलिग्नेंट का क्या नाम रखें? फॉलिक्यूलर कार्सिनोमा. Perfect. Now you ask me, I want to differentiate between benign and cancer. I say just look for two things. One, capsule should be invaded. Excellent. I'll show you pictures. Capsular invasion देखो. दूसरा, very good, blood vessel में ट्यूमर गया है या नहीं? Vascular invasion. So remember, capsular invasion होना चाहिए to call it cancer. Vascular invasion होना चाहिए to call it cancer. And if both of them are not there, it is benign. Have a look at photo. Remember, capsule, capsular, vascular. Have a look at this. Can you see in this picture, यहाँ पर एक capsule है, यहाँ पर एक capsule है, and then I see it's broken over here. Can everyone appreciate? It's broken over here. You feel something like a mushroom is coming out. Something like a mushroom has torn the capsule and has come out. Can I call it capsular invasion? What do you want to call it? Follicular adenoma or carcinoma? क्या बोलेंगे इसको? What do you want to call this? Carcinoma. Okay. Image number 2. Can you all see these red color cells? Red color cells मतलब ये क्या है? Blood vessel. Such a big blood vessel. And then who is sitting inside this blood vessel? Tumor is sitting inside it. Do you want to call it vascular invasion, follicular adenoma or carcinoma? Follicular carcinoma. So what are my two criteria? Vascular invasion, capsular invasion. If I see these two, follicular carcinoma. So now tell me, will you be able to see such a big capsule and such a blood vessel only on a FNSE? FNSE में needle डाल रहे हो, एक needle में will you be able to take out the full capsule and see it, the full blood vessel and see it? No. So will you be able to diagnose follicular carcinoma thyroid on FNSE? No. Remember, this is only on surgical biopsy. This is only done after surgery. Once the full nodule has been taken out, then we look for capsule and vascular invasion, then we give a diagnosis. Agar hai to carcinoma, nahi hai to adenoma. 4 questions done. Everyone's comfortable. Should we proceed forward? अच्छा, 2 ऐसे confidence booster questions हैं ऐसे just for picking up the speed. So let's talk about them. इसका आंसर दो. 15 seconds I'll give you only, and please give me a very good answer to it. 2 one-liners, confidence boosters. Tell me, jerky or twitching motility? Okay, so 57%. Jerky or twitching motility? First, let us see the leaderboard. Acha, so 50% of you said Trichomonas vaginalis. 30% of some of you said Giardia lamblia. Okay, never mind. Then tell me falling leaf motility. And before I start the poll, read all options. Falling leaf motility. I've given you that rider that read all options. वो caution I have given that caution to you. Read all options. 80% are right. 80% of you are right. So because I know when I say falling leaf motility, all of you jump to which organism? जैसे we say falling leaf motility, you say Giardia lamblia. So I was expecting यहाँ पर you had to, I didn't want that to happen, and I didn't want some 90% of you jumping, so I told you read all options. First and foremost, yes, twitching motility or jerky motility is Trichomonas vaginalis. And second, falling leaf motility is Giardia lamblia, but trophozoite, because if you remember वो जो angry face वाला है, that angry face wala, that has the flagella, तो movement trophozoite show करेगा. So please remember, in the exam I was there to tell you, but in the exam also I gave you a caution because abhi I know exam pass mein hai, so I don't want to trick you and feel happy about it कि अरे you all of you answered this. I want to help you, but I will not be there to help you. So you are supposed to read the options very carefully and then attempt. Is that okay with everyone? Chalo. Having said that, I think chylomastics mesnelli is what you're asking me. This is also, matlab, all the options that are written over here, na, Giardia, Trichomonas, they are flagellated protozoans basically. So chylomastics is also a flagellated protozoan, but usually, overall, अगर हम usual देखें, so it is considered as non-pathogenic to humans. So nothing much that you need to be worried about, but for all practical purposes हम इसे Giardia lamblia का ही मतलब cousin brother, you can say cousin brother of Giardia lamblia in many terms, but in terms of human infection it's not very important. So someone had asked me about this, that is it. Okay, chalo, these 2 confidence boosters are done. Now let's move on to the next set of questions, and one very important question which is a must for all of you to know now. Again, 30 seconds, quick answer. This came, something to do with this has come twice in the last 2 years. Firstly, it came in 2019 NEET, then it came in 2020 FMG. So this particular topic, yes, August का exam question था, and this is what was important. तो previous year question गलत नहीं करना. 52%. Let's see the leaderboard. Very good. So we are getting top 9 have got all 7 on 7 correct. First and foremost, 40-year-old female with headache. यहाँ तक कुछ ज़्यादा पता नहीं लगा. All my options. You guys go retrospective now. All your options are to do with brain tumors. Okay. A left subfrontal mass is resected. Microscopically shows whirling of the tumor cells. Hint number 1. Expressing progesterone receptors. Hint number 2. अब I've changed the question. This is not the same question that came in your previous year. This topic came in your previous year. तो अब question में क्या change आया? Answer to this question, meningioma. What are the two catch points I've given you? I've given you whirling of the tumor cells, positivity for progesterone receptor. So how else can the question come? Have a look at this. This is how it came in the August 2020 FMG. Do you guys remember? The same image had come. Exactly same picture was copy pasted in the exam. So you can very well see that there is a dura-based tumor. It is arising from the meninges. There's a tumor that was given that was arising from the meninges, number 1. ये photo था. Apart from that, they will tell you that microscopically you see, so first and foremost cells कैसे present होते हैं? Either they are present 1 1 1 1 ऐसे sheets में present होते हैं ना, but over here it looks as if they are trying to wrap, they are trying to wrap, they are trying to wrap. So basically they are trying to form whorls. There is whirling of the tumor cells. Whirling मतलब round 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 whirling हो रहा है, ठीक है, wrapping हो रहा है, that is whirling. तो वो हो रहा है, fine. Third thing, any calcification that I'm missing out on, not shown you for meningioma. बहुत classical calcification, वो calcium भी round round होता है, very good. You see the presence of samoma bodies. You see the presence of samoma bodies. Excellent, excellent. So round round calcification. Then you have round round tumor cells, whirling हो गया. You see a dura-based meningeal tumor. Obviously, it is a case of meningioma. Is it more common in females? Yes, it is more common in females. And females में progesterone तो होगा ना, तो progesterone receptor positivity has been noted. So yes, I know I changed question, तो मैंने same नहीं करा है. Question I have changed, but anyway same question नहीं आएगा. That is how you attempt previous year questions. Even now I would want to tell all of you, when you're practicing previous year questions, because you've got what, 15 days na, if you broadly take for all the exams 15 days hai, so practicing previous year questions doesn't mean that the same question will come in your exam. It means that you will get to know the topics that are coming again. So what you have to revise is the topic. अगर meningioma पे question आया है, तो revise meningioma from your notes. That is how you practice previous year questions. Not that same samoma body, हर बार samoma body आएगा. Okay, other options are not at all fitting in. Other options are totally useless over here. Progesterone receptor and whirling of the tumor cells is no other tumor that is written over here. Other option, this is total, मतलब बाकी options close differentials में भी नहीं आते. Whirling and progesterone receptor nowhere close. Okay, let's go to another previous year question. They didn't give you the image.